This is Dr. Surindher. I am Director of Aesthetics Plus Clinics. Welcome to our channel. What is breast augmentation and who needs it? So breast augmentation or a breast enhancement surgery or a breast enlargement or breast implant surgery, these are all names given to the same procedure. The procedure is basically to increase the volume and the size of the breasts if they have not developed properly, or and give you a better sense of fullness and a better sense of balance to the body. In nature, you see things appear to be in balance. Whenever there is something which is off balance, then you start noticing that okay, there is something that could be changed. So it's the same, and so the balance comes from proportions. So there has to be a relative proportion between one thing to the next. So then you know that okay, whether it is bigger or smaller, or how you go about it. So the same way in the body. So if your breasts are smaller in proportion to the shoulders, or in proportion to your body structure, in proportion to your height, in proportion to the butt, then yes, that is when it starts looking odd. If was somebody who is very lean and thin and petite and short, maybe a too big a breasts are not needed because they would look out of balance. Similarly, somebody who is tall or somebody who has broad shoulders or a broad hips, then for them too small breasts might not look very same. So it has to be individualized according to your body structure and according to your needs. So the procedure basically is to put in a silicone implant or your own fat to increase the volume and to enhance the bust. So that is basically in layman terms what you call a breast implant surgery or a breast augmentation surgery. So if it is your own fat, we have to take it from somewhere else in your body, and then we have to isolate it and we have to inject it back. If it's an implant, then you have to we have to measure your chest. We have to see what is the size of implant that can fit into your chest, and then do the surgery. The surgery is pretty simple and straightforward when done by somebody who's been doing it and by trained plastic surgeons. But if you go to untrained people and you have issues with mismatch of size or not in the right position, or other issues as well. So do your research, do your understanding, find out what you need, and then take a call. Now, as far as the question is, who are the people who actually need breast augmentation? So I said the first thing is breast augmentation is done for somebody who sees their body and they know that something is not right because it's out of proportion. Your breasts are not in proportionate to the size of your shoulders, your height, or your hips. So we have to see you as a whole, and then yes, we can do the procedure. We prefer not to do it before 21 years. Because your growth is still going on, your hormones are still active, and your breasts are still growing. So unless there are some extenuating circumstances in which you need to do it after 18 or 19, we still would prefer to wait till you're about 21 before we try and do a breast augmentation procedure for you. Secondly is the other subset of people who come in for a breast augmentation are post-pregnancy or post-childbirth. So normally what happens in fatty breasts or post breastfeeding or post pregnancy is the glands are enlarging and they replace the fat. So the fat is gone and the glands have enlarged, so that's why your breasts enlarge when you're breastfeeding and you're pregnant. But once the feeding is complete and your pregnancy is over, your breastfeeding is complete, then the glands go back to their normal size. So with this shrink. So once they shrink, that fat which was lost doesn't come back, and that causes a sag and emptiness of the breast. It depends. The more fatty the breast initially, the more loss and more sag. The less fatty the breast initially, less fat less loss and less sag. So those are the second subset of people whom you need to do breast augmentation for, to bring back the breast to their volume. Ideally, it can be done in between kids as well, or it can be done after you finish your family. Sometimes you might have to add a breast lift along with the augmentation procedure as well. When you do it with a silicone, then it just stays there. When you do it with fat, of course, when you have next pregnancy, the fat might again get replaced. So that's another. The third set of population where we do breast augmentation is for post-cancer reconstructions. So when you have a breast cancer and the breast has been removed, so nowadays, because detections are earlier and people are more aware of it, so more and more we are doing lumpectomies and smaller removal of the breast rather than the whole breast to be removed. So, and many times you can remove the breast and still preserve the skin capsule. So see the skin around. So these are the kind of cases where we can do a reconstruction. So we do something called a flap to cover it, and then we use an implant inside to again give you the volume and balance it out with the opposite breast. So these are some of the main indications of why you need a breast augmentation or when you need a breast augmentation. But it is a very individualistic procedure, not the same size or the same size cannot be put for everyone, and that is why your input is very important when you're talking to your surgeon. So you have to do your research, you have to understand your procedure, you have to understand what size you want or what is the kind of look you're looking for, and that will help your surgeon decide what is right for you. And so you have to take a very active role in deciding the size and what kind of a look you're looking for, whether you need cleavage, whether you need fullness, whether you want more side fullness rather than perkiness, or whether you want perkiness. So there are a lot of factors to consider. So make a call and decide according with what is necessary for you, and then work it out with your surgeon and explain it to him so that he can understand and try and give you the best result possible. Thank you. Keep watching.